The learning objective for Lesson 2 is to understand the importance of collecting together, or collating, the data from each single case report before applying a guideline for case series assessment. It is essential to consider each patient, the drug, the suspected adverse drug reaction, and the outcomes. So what guidelines do we have for clinical assessment of a group of reports? First of all, we need to consider what each report tells us about the patient, just as we did for single case reports. Also the suspect drug, and any other drugs the patient was taking, including prescribed, over-the-counter, and herbal and other complementary and alternative medicines. The reported adverse reactions and the outcome for the patients, including what happened on de-challenge and re-challenge, if reported. Seriousness should also be recorded, since this influences what action will be taken if a signal is detected. What does each report tell us about the patient's demographics, their gender, their age, also their other clinical conditions, relevant genetic predispositions if known, other non-drug exposures, reactions to other medicines? For the drugs, suspect or interacting, we need to note their anatomic therapeutic classification, the ATC group, the dose, the duration, the start and stop dates, and as much information as possible about concomitant drugs. For the adverse drug reaction, the system organ class it belongs to, the specific symptom or condition reported, the date of onset and recovery, and also co-reported adverse reaction terms which may provide important information about the suspected adverse reaction in the case series. For example, a series of reports of jaundice would be difficult to interpret because jaundice occurs with a number of hepatic or biliary disorders. What is the drug actually causing? However, if many of the reports in the case series also list gallstones as an adverse reaction term, then a reason for the jaundice becomes apparent. Once we've found out what is already known about the suspect drug or drugs and the suspected adverse reaction, we can look for patterns in the collated reports that lend support to a causal relationship, and perhaps evidence for risk factors too. We can then go on to using the causality assessment criteria developed by Sir Austin Bradford Hill. Before we consider these criteria, for those of you who want to read more deeply, you will also find it interesting to read about two approaches to classifying adverse reactions which help with causality assessment. The IDOS system focuses on the mechanism by which the adverse reaction may occur, and the DOT system on clinical pharmacology, dose responsiveness, time course, and susceptibility. Professor Edwards' article deals with the principles of causality assessment in depth, and all of the authors recommended the use of the Bradford Hill criteria.